Hey, what's up everybody? Chris, paramedic here again to teach you about wound packing. Yeah. All right, so let's talk about wound packing. Couple things to note about wound packing. Number one, this may or may not be within your protocol. So it's really important just to make sure that you are allowed to wound pack if you are going to go out in the field and do this. You might be watching this as not a professional responder. Maybe you've taken a Stop the Bleed course or something like that. In that case, this is just a great life skill to have. But if you are a professional EMS responder, this may or may not be within your protocol. So you should double check that this is within your protocol. And if it's not, double check with your medical director that you are able to wound pack if you have learned the skill. Okay, so always important for us to make sure we're operating within our limits and our scope. Second thing about wound packing that's important to remember, wound packing is not meant for every single wound in every single area of the body. Wound packing is going to be for typically like arterial bleeds or more significant heavy bleeds, and we are only going to be wound packing at the junctional areas of the body typically. So when we have a bleed that's in a different part of the body other than the junctional area, hopefully we can use a tourniquet. So on my arms, on my legs, if I have an arterial bleed at the radial site, I can put a tourniquet on to stop that bleeding, okay? So there's no need to wound pack in that situation. And when we talk about the thoracic cavity and the abdominal cavity or just any hollow cavity of our body, if I have a gunshot wound in my chest and I try to pack that full of gauze, I'm not going to be packing and causing pressure on that wound. I'm going to be filling that empty cavity. So this is not meant to be used for chest injuries, abdominal injuries, anything like that. This is typically going to be up in the shoulders and in the hips. So places that you may have some significant bleeding, but you're not able to get a tourniquet on. If I have a gunshot wound in my shoulder, I can't put a tourniquet on to stop that bleeding. Direct pressure might not be enough. That's where wound packing is going to come in. So wound packing, essentially what we're doing is we are doing a pressure bandage inside of the wound instead of from the exterior, so we can be a little more specific about where we are going to place the pressure on that wound, okay? So I have a little prop here that's going to bleed here in a second. It will be pretty heavy bleeding. We're not going to really be able to see it, but if you have the ability to visualize where that wound is specifically or that bleed is specifically, that's going to be your first step. If you can visualize where that is, try to take a look, and we can do direct pressure with the finger right over that artery or whatever is bleeding to try to stem the bleeding then and get it stopped. That is not going to hold for transport, right? We're not going to be able to hold a finger in the wound for a long period of time, and that's where wound packing is going to come in. It will also help if we have a large wound to the hip or wherever, and we can't see exactly where that bleeding is coming from. We can pack that wound to pack it full and put some pressure on that bleeding area to hopefully stem that bleeding and stop that bleeding, okay? So when I have identified that I need wound packing, it's a significant bleed that looks probably like it's an arterial bleed and it is in a junctional area. Next, I need to get my materials. And this is a really simple thing. Just some nice roller bandage, some Kerlix gauze is really all you're going to need for this skill, okay? You're going to want something with some volume. Just a 4x4 or something isn't really going to work. So we have a small Kerlix and a large Kerlix here. Either one will be okay. You may need multiple Kerlix gauze. If that is the case, and just based off the size of this wound, I know I'm not going to need to do this, but you may need additional gauze. If that's the case, you can just take your two gauze and you can tie a knot and tie them together, and then you can feed that second one in and continue your wound pack with that second roll of gauze, third roll of gauze, whatever you need. Really important if you're doing that to make sure that you are tracking how much gauze you are packing into the patient, okay? It can be really difficult when they get in for surgery for them to identify how much they're pulling out. So we want to make sure that they know 2 were placed in, I need to pull 2 out. We don't want to have a patient have a whole roll of gauze left in their hip because it was not tracked. So a couple ways you can do that. You can write it down in your charting software or on your chart. You can keep the packaging with you somewhere. So you see you have 2 packages of Kerlix. You know that 2 packages of Kerlix were used for wound packing. However you want to do it, just make sure that you are tracking that so that we don't have a surgical mistake. And you can find lots of stories about sponges and scissors being left inside of patients. And that's with the staff knowing what was in there because it's their surgery. So we definitely don't want them to think there's only 1 roll when there's actually 2. So just make sure you're tracking that down. So I have identified my wound. I have my equipment. What I really like to do is to take the end of my Kerlix gauze, and I'm just going to tie a knot in that Kerlix gauze, okay? This is going to give me a nice focal point for my wound pack. This nice knot, it's a little bit bigger, a little heavier, and this is what I'm going to start my pressure with. And this is, if we can identify exactly where that bleed is coming from, this is what we are going to place over that bleed, okay? So from there, we're going to feed it in. If you can visualize the wound, not a bad idea to just go with your finger, and you can place your finger into the wound, and you can put direct pressure just with your finger, and then you can start to pack the wound after that with the gauze. This should hopefully stop. You can do this direct pressure down on the wound and hopefully stop that bleeding, like I said before, but we're going to want to pack something that we can leave in there for a longer period of time. So I'm not stuck doing this during the entire patient movement, transport, all of that stuff, okay? So if you can't do that, then you're just going to pack the wound like I said before. So let's give this a go. We're going to go ahead and just open this up. You're going to see it's going to flow, and I'm going to try to stem that bleeding with my wound packing. If you are an EMT or if you work in education or you work at your department and you do some training, I highly recommend just looking around. We're not sponsored anything like this. We purchased this prop off Amazon. It was only like $100 and it works really well. So this is something that I would really recommend. I think the realism of having the bleeding wound kind of helps add to that anxiety as we are doing this and can help just make it a little more real life. So, but yeah, there's lots of props out there for you to get to practice this skill. So we're going to open this up. Like I said, it's going to bleed, and we're going to try to pack it here. So you'll see we have blood coming out. I can't identify where it's at yet, so I'm going to start my pack. And as I start to pack, I'm going to hold pressure with my finger. And you can see now the bleeding has already stopped. I know where the wound is, so I was able to hold that pressure. But if I were to take my finger off and pull some of that pressure off, it might start bleeding again. So I'm going to hold that pressure down. You can use your thumbs, you can use your pointer fingers, whatever's most comfortable for you. Now I'm going to take the next piece of gauze, and I'm going to fold it, and I'm going to push it in, and I'm going to take over pressure with that hand, okay? The important thing about this is to continually hold that pressure. We don't want to take pressure off because then whatever we stopped is just going to start again. So I'm holding that pressure. I actually personally like to do thumbs. I feel like the thumbs are a little easier. And I'm going to hold with the thumb, and I'm going to come in here with the next fold, and I'm going to pack, and we can keep going until that wound or that bleeding has been stemmed, okay? And you can kind of do that where you hold down and you go over and over if that's easier for you to pack it. Whatever works for you, the big takeaway is just make sure you are continually holding that wound. So I'm going to keep that pressure on. I'm going to keep packing. I'm going to keep packing. And I want to pack essentially until I have a spot where I know I can put a nice pressure bandage over. So I'm here. I've got that bleeding stopped. We can see it's no longer actively bleeding. I'm still holding my pressure. I have a little bit left. I can take that over and hold that pressure here. And now I can put a nice pressure bandage around the patient to focus this pressure down on the wound, okay? This is not a difficult skill. I think with this prop, I think if I let go, it'll actually, I think it's pretty well stemmed. Not uncommon as you pack the wound. You're putting that pressure initially directly down through your fingers, but as you start to pack the wound itself will increase the pressure on that bandaging, and so hopefully it will be stemmed, and we're just putting that pressure bandage around to keep it from popping out. So we're essentially creating a clot with our Kerlix here. So Once it's stopped, like I said, we'll go ahead and put that pressure bandage on, and we're ready for transport, okay? There's not really much to it. It's a pretty easy skill, but if you need to do this, they're probably going to be bleeding pretty heavily. So this is one of those kind of low frequency, like high scary factor type of calls that you're going to see. So highly recommend you practice your technique with this. Not difficult, but it can be a life-saving technique if you get to that point. So pretty simple. Go ahead and pack until the bleeding stopped and you're able to put that nice pressure bandage over it. You may work at a system that has some sort of hemostatic gauze that you can use for this as well. In my experience, most systems don't carry the hemostatic gauze just due to cost. It expires much quicker than just a normal gauze, and they don't get used very often for the price. So you may have that, you may not. It won't really matter for this. You're just, oh, I took that pressure off and she started bleeding again. So we'll hold it down here. So yeah, just use whatever you have at your disposal if you need to do some wound packing. So that's all we got for you for wound packing. It's a pretty simple thing, like I said. If you are not a first responder and you're interested in EMT classes, check out IdahoMedicalAcademy.com. We have EMT and advanced EMT classes. We have in-person here in Idaho. We have online courses that you can take from home and then come into one of our skills locations to finish it out. If you have one close to you or fly in for a couple days, make a little mini vacation out of it, little education vacation. We might have to coin that term, education vacation. So yeah, if you're interested, go check out IdahoMedicalAcademy.com. We still are running a promotion for YouTube subscribers. Put code SUMMIT in when you do your registration for 10% off. Otherwise, thanks for watching. Get your practice in because this can be a life-saving skill. Go out there, do great things in your community. Thank you.